Dr. Saenz will be doing a anatomy of the meniscus for us, and then we'll begin live surgery.
So then we talk about the anatomy of the meniscus, focus to the transplant meniscal. The meniscus is divided into three parts: anterior horn, the posterior horn, and the body. The anterior horns are united by the anterior transverse ligament. This ligament is present about in 69 and 94%. Here, to view it from inside of the joint, we must raise the fat part of Hoffa. This is one. Here we are a posterior view in a coronal section with the femur rejected. This is the patella, tibial plateau, meniscus, and this is the transverse ligament. The meniscus is divided into three areas in a coronal section. One central area, the most medial, two, the middle substance and the peripheral area, the middle substance and the peripheral area. This peripheral area is the only with blood supply. The insertion of the meniscus is essential in the meniscal transplant. This picture shows the attachment of both meniscus and its relationships with the cruciate ligaments here. The anterior horn of the medial and the lateral meniscus are located in the anterior intercondylar area, separated by the origin of the anterior cruciate ligament. This is the origin of the anterior cruciate ligament, anterior of the lateral and the medial meniscus. And the posterior horn of the medial and lateral meniscus are located in the posterior intercondylar area in front of the attachment of the posterior cruciate ligament. About the attachment of the medial and lateral meniscus, the anterior horn of the lateral meniscus attached close to the origin of the ACL here. In this anterior view, we see the ACL ligament and his relationship with the anterior horn of the lateral meniscus. Then the fibers of this anterior horn of the meniscus seems to be a continuous with the ACL. The posterior horn is attached just behind the origin of ACL. Here we have the ACL, and here the posterior horn. It's important to remember that the anterior horn is parallel. This is parallel to the tibial plateau, and the posterior horn attaches perpendicularly to the tibial plateau. This is the posterior meniscofemoral ligament, and this is the PCL. In reference to the medial meniscus, the anterior horn is attached to the anterior border of the tibial plateau. It falls down over the tibial plateau. And the posterior horn attaches just anterior to the PCL. This is the posterior horn, just anterior to the PCL, separated by a bursa. There are two different options for meniscal graft. Meniscal graft with bone plaque and meniscal graft without bone plaque. Remember that it is basic to establish a meniscus size matching between recipient and donor. Three different methods. One, low accuracy, correlation of age and weight. Two, tibial plateau dimensions measured by X-ray. And three, the most important, tibial plateau dimensions measured by MRI. Thank you very much.
Very good. Thank you.